Eric. I'm a student at Excelsior University, current course Nursing 105. My professor is Dr. Johnson. Today I'm going to be demonstrating furosemide IV push. Today I was assigned patient Renee Adams, date of birth 5/25/1978. The patient has no known drug allergies. The MAR reads furosemide injection 10 milligrams per ml, 20 milligrams IV push Q12 hours PRN for weight gain greater than 3 pounds to be administered over 2 minutes with 3 mLs of normal saline flush before and after. Once again, the order reads furosemide 20 milligrams, that will be 2 mLs, IV push Q12 hours PRN for weight gain greater than 3 pounds to be administered over 2 minutes with 3 ml normal saline before and after. Go ahead and prepare my patient medication. First, I'm going to gather my supplies and perform hand hygiene. Okay. So now I'm going to set up my medication by first cleaning the medication vial with an alcohol pad, maintaining aseptic technique. Okay, now while that dries, the order reads 3 ml normal saline flush before and after. So I'm going to confirm these both are safe to use. Both flush say expired November 1st, 2028. I have 2 5 ml syringes with normal saline that are already labeled, but the order is for 3 ml, so I have to discard 5 ml. I have to discard 2 mLs, maintaining clean field. Okay. 3 ml. 3 ml. Now I'm going to prepare my syringe, removing the safety cap, opening my needle, attaching. Now the furosemide is furosemide 10 milligrams per ml. The order is for 20 milligrams, so I'm going to draw up 2 ml. I'm going to draw up 2 mLs of air, inject and invert, inject the air into the vial, and then draw up my patient's medication. If I see any air bubbles floating, I'm going to make sure that I rid that, as we don't want any air to enter the patient's venous system. I see one little air bubble, we'll get rid of that. And now I've successfully drawn up 2 mLs of furosemide. I'm going to provide the safety cap without touching anything. And now I'm going to make sure I label my medication. I have furosemide 10 milligrams. The order 10 milligrams per ml. The order is 20 milligrams. So I've drawn up 2 mLs. So I've confirmed for the 3rd time that my medication order is correct. So now I'm going to head into the patient's room. Hi, Ms. Adams. My name is Erica. I'll be your nurse today. Ms. Adams, Ms. Adams, my name is Erica Robinson. I'll be your nurse today. I'm just going to provide privacy. Ms. Adams, I just need to verify your name and date of birth. The patient says her name is Renee Adams, date of birth 5/25/1978, but I need to confirm that for myself. I'm going to perform hand hygiene and confirm the patient name is Renee Adams, date of birth 5/25/1978. Once again, the name is Renee Adams, date of birth 5/25/1978. Ms. Adams, do you have any allergies? The patient verbalized she doesn't have any allergies. Ms. Adams, I just want you to know your doctor prescribed the medication for you today. It's called furosemide. It acts as a diuretic, as your diagnosis for admission is CHF. And because of this diagnosis, your body is retaining some excess fluid, and this medication will help the body rid it. I've left a hat in your bathroom, so please don't flush the toilet. as we need to collect all your output for the shift. Okay, and you're going to ring the call bell, and myself or one of the assistants will be able to help you. So now I am going to assist the patient's IV site for any signs of infiltration or inflammation. I don't feel any warmth, any coolness. The site is safe. So now I am going to select my site. This is the port I would like to use for the patient's medication. I'm going to scrub the hub for 15 seconds. Ms. Adams, I just want you to know that when I administer the medication, I have to administer it over 2 minutes. And the reason for this is because one of the signs and symptoms are ringing of the ears. So if I administer it slowly, it's a possibility that that won't happen to you. Okay, I've already scrubbed the hub for 15 seconds. I'm going to perform my first flush. I'm going to attach the normal saline, and I'm going to gently aspirate to check for blood return. I have some blood return, so my line is patent and it's safe to administer the first flush. The first flush does not have to be administered over 2 minutes. Only the medication and the last flush does. Okay, the line is nice and patent. I'm just going to keep everything clean, dispose this in the correct receptacle, and I'm going to scrub the hub again for 15 seconds. Okay, now that I've scrubbed the hub for 15 seconds, I'm going to let that dry a little bit. I'm going to disconnect my needle, and I'm going to enter this needles into the sharps container for safety. And now I'm going to connect the patient's medication and just make the patient aware again that, Ms. Adams, I have to administer this over 2 minutes because this medication tends to cause ringing of the ears. Starting now. Ms. Adams, I'm sorry that this takes so long. Just trying to prevent any side effects. Once again, I'm going to leave the call bell at your side so you can call us whenever you're ready if you need assistance to the restroom. Please remember not to flush void into the hat as we need to monitor for your output to make sure that the medication is working. Awesome. So now that we've administered this medication over 2 minutes, it is 2 minutes now. Okay, I'm going to disconnect slowly. And now, Ms. Adams, I'm going to scrub your hub again for another 15 seconds to assure your safety. Okay. And now that we've performed the scrub hub for another 15 seconds, I'm going to perform your last flush, which will be for 2 minutes. Are you okay, Miss Adams? Are you comfortable? Are you experiencing any pain? Patient verbalized she's not experiencing any pain or discomfort. Miss Adams, do you understand the instructions I provided to you about voiding in the hat? The patient verbalized she understands the instructions for voiding as we need to monitor her output. Once again, Ms. Adams, I have to perform this flush over the same medication, the same duration, because there's medication left in your line. So you just want to make sure you get the full dose. We're almost there. Okay, we have safely administered the last flush for over 2 minutes. I'm going to disconnect. Okay, I'm going to reassess the IV site. There's no signs of infiltration or inflammation. The patient is safe. I'm going to now dispose my gloves in the proper receptacle. I'm going to perform hand hygiene. I'm going to ensure the patient's safety. She has her call bell. All her needs is met. Ms. Adams, are you okay? The patient verbalized she's okay after medication administration. And I am now going to exit the room as the patient is safe, and I'm going to document. Thank you.